If you could prescribe one medication that lowers blood pressure, improves blood sugar, reduces inflammation, boosts mental health, and helps you live longer, it wouldn't be a pill. It would be exercise. Hi, I'm Athena Newell, family nurse practitioner and functional medicine provider at Stat Wellness in Charleston. My background is in exercise science, and I spend my days helping patients improve their health through medicine and movement. So today I want to walk you through what the research actually says about exercise and heart health and what you should do with this information. So why does exercise matter for heart health? Heart disease is still the #1 cause of death in the United States. But here's the more important part. Most of the drivers of heart disease are lifestyle related. We're talking about things like insulin resistance, chronic inflammation, high blood pressure, visceral fat, which is that hard fat in your midsection, and stress overload. Exercise directly improves all of those things. It improves blood vessel function, lowers blood pressure, improves cholesterol patterns, and reduces inflammation markers in your body. So if exercise were a drug, it would be the most prescribed medication in the world. Let's talk about one of the most important numbers in cardiovascular health, your VO2 max. VO2 max measures how efficiently your body uses oxygen during exercise. In simple terms, it tells you how well your heart, lungs, and muscles are working together to pump oxygenated blood around your body. Here's why it matters. VO2 max is one of the strongest predictors of how long you live that we can measure in a clinic. People with low VO2 max have a dramatically higher risk of cardiovascular disease and death, similar to risks seen with smoking and diabetes. Even small improvements in VO2 max significantly lower mortality risk. So improving your aerobic fitness isn't just about endurance, it's also about improving your longevity and overall wellness long term. Now let's talk about strength training. When people think about heart health, they usually think about cardio, but strength training is one of the most powerful tools that we have for metabolic and cardiovascular health, because muscle is actually a metabolic organ. Your muscle stores glucose, improves insulin sensitivity, and helps regulate blood sugar after meals. More muscle means better blood sugar control, lower risk of diabetes, lower inflammation, and improved resting metabolism. Strength training also improves blood pressure, affects arterial stiffness, and even heart efficiency. So lifting weights isn't just about getting stronger, it's about protecting your heart and metabolic health long term. Cardio still matters, but how you do it also counts. We want to mix daily, low-level movement like walking, aerobic training that builds endurance, and occasional high-intensity work that improves your VO2 max. Even something as simple as a 10 to 15 minute walk after meals can significantly reduce your blood sugar spikes. Regular movement improves stress regulation, which directly impacts cardiovascular risk. So the goal isn't extreme workouts, it's consistent, intelligent movement. So what does a heart healthy routine actually look like? Here's what I typically recommend to my patients. Strength training 2 to 3 times per week, including functional movements like squats, hinging like deadlifts, presses, and pull type movements for the upper body. I would include some form of high intensity cardio once or twice a week. This can be intervals on a bike, on a treadmill, rowing, sprinting, or walking uphill, and daily walks. Even short walks throughout the day improves metabolic health. But heart health isn't about perfection, it's about consistency. Where to start if you're feeling overwhelmed? If you're sedentary right now, don't start with an intense movement program. Start with short walks. They improve your sleep and reduce stress. Then build from there, because sustainable progress also beats short bursts of motivation. At Stat Wellness, we combine medical care, metabolic testing, movement screenings, and personalized plans to help our patients improve their long-term health, not just improve their lab numbers. If you want help building a plan that actually fits your life, you can schedule a consultation with one of the providers at Stat. And if this video helps you understand how exercise protects your heart, like the video, subscribe, and share with someone else who needs to hear it. Because the best time to start protecting your heart isn't years from now, it's right now. Thanks for coming.